And Governor, I want to thank you for putting the pressure on the federal government to get this treatment to the people of the state of Florida, and in particular to our vulnerable citizens. Just briefly, I wanted to add on to the hospital statistics so that you all get a sense of what the context is, and so people in the state of Florida really have the right information. There are currently 5,725 confirmed and suspected COVID hospitalizations. That's 5,700, a decrease of 67% since our most recent peak on August 18th, when there were 17,360 hospitalizations. Of these hospitalizations currently, 97.5% are adults, 2.5% are pediatric. Of the current 5,725 confirmed and suspected hospitalizations, a mere 11%, or 629, are in ICU beds. That is a decrease of 82.79% since the most recent peak on August 24th, when we had 3,654 people in ICUs because of COVID. That's the information that the people in the state of Florida need to know when we're seeing headlines talking about skyrocketing and spiking, et cetera, et cetera. These numbers bear out what Dr. Latipo and others have been saying about what we're doing and where we stand. Thanks to the governor's leadership, people have access and hopefully will have greater access to treatments that can help them weather this virus. And I and my agency, Governor, stand ready to assist in any way we can. Thank you.
And in terms of the distinction, like, you know, the numbers that are actually because of COVID versus just happen to test positive, the pediatrics is overwhelmingly that are in for another reason and are an asymptomatic case. And so that's whatever percentage that is, 40, 45, 50% of all that number that Simone mentioned, that is certainly higher than what we've seen in past waves. It's usually been about 20 to 25%. But it also, you know, HHS should probably change the way that they're reporting this at this point, because it really isn't instructive if you have something that's very widespread and mild and it's catching people as they go in to the hospital with positive tests, but they're not actually have any type of clinical diagnosis. So, okay, we have Cord Bird is here. Actually, we'll do Dr. Moreland and then Cord Bird.
Thank you, Governor. Thank you very much. Yep. Good morning, and thank you, Governor DeSantis, for once again coming to Jacksonville and to discuss this important treatment. Just a little over 4 months ago, Governor DeSantis came to Jacksonville to introduce our first Regeneron clinic and to discuss how monoclonal antibodies were saving lives. Today, we are fortunate that the governor is working to bring much needed a second site to North Florida. Our governor has demonstrated time and time again that he cares about the people of Jacksonville and the people of the great state of Florida. Governor DeSantis has been steadfast in his support of our community. He has always been quick to respond to any requests for support, from testing, vaccinations, and monoclonal antibodies. This virus, specifically the Omicron variant, is very contagious. In addition to the vaccine, this treatment, monoclonal antibodies, is one of the best tools we have to prevent severe illness and death from COVID-19. We've heard from doctors and physicians here in Jacksonville and throughout our state who have seen numerous patients undergo this therapy early in their diagnosis benefit greatly from this treatment. From the beginning, our mayor, this city, has taken measures to ensure our hospitals are not stressed. This is another mechanism to do just that by providing an off-site location for this beneficial treatment and freeing up space in our hospitals for those most in need. I am confident this will continue to save lives in our community. Again, and I must stress this, thank you, Governor. Thank you for continuing to support Jacksonville and for continuing to provide strong and unwavering leadership in the state of Florida. Thank you.
All right. Cord.
Good morning. Thank you, Governor. The governor in his remarks mentioned that last summer when we had the Delta wave that we were able to get monoclonal antibodies, and I'm here to, as a testament to that, as I contracted the Delta variant over the summer and was able to get treated with monoclonal antibodies, which reduced the symptoms and shortened the time period of sickness. Unfortunately now, 6 months later, I have friends over the holidays who were coming to me saying, can we get them? We want to get them. I want to get treated. I've contracted the virus, and they're not able to get them. So I thank the governor, and I know my colleagues in the legislature, Wyman Duggan, Clay Yarborough, who are with us here today, stand with the governor and asking the Biden administration to stop playing politics with people's lives, stop playing politics with medicine and treatment. Get us the treatments, and we will. The governor and his team are ready to get people in Florida treated and healthy. So, Governor, once again, on behalf of the people in North Florida, thank you for all your efforts.
And we've also, through Kevin at DEM, in the last 6 months, we've sourced 1,500 requests related to testing throughout the state. We are, the White House promised that they would be sending out at-home tests. I don't think anyone's seen any of those yet. So what we're doing is, we're gonna get some, and we're gonna start with the nursing homes and long-term care facilities and other senior areas. At the end of the day, if the people that are most likely to need clinical attention have an easy access to this, then they can be able to potentially come in and get treatment. Waiting in line if you're 80 years old is not the best thing for them. So Kevin and I will likely have an announcement on that very soon, but we've yet to see anything from the feds in terms of those at-home tests. So stay tuned on that. And with that, happy to take some questions.
Governor DeSantis, a Jacksonville resident was removed off his property just for wanting to come to his.
So I have no idea what happened, so you can save that for me. Yes. So I just announced we're gonna, because the federal government has not followed through on its promise to do at-home tests, we are going to be doing that, starting with a focus on elderly population. And as I've said, we've sourced 1,500 requests across the state, including some to Jacksonville over the last 6 months. And as more supply come in, we'll do it. I think, though, that what you've seen is they just haven't had the supply where it needed to be. If your policy is forced testing to travel, CDC saying you have to get a negative test maybe to go back to work, we won't follow that in Florida, but that's what they're saying. A lot of those tests are not a good use of testing. Testing really needs to be focused on the people that have clinical symptoms. So you have people that are symptomatic, and they may not have as good access because you have so many other tests being used in ways which really aren't a good use of resources. And if you're going to do that later, that policy that they've been following, well, at least make sure that there's enough tests to go around, and there obviously isn't. So as soon as we figured out the feds weren't going to follow through on this, we've been working. We definitely are going to be sending some at home. The question is how many? There's obviously a lot of folks, I think, coming to the realization that the federal government's not going to come through like they promised on that. And I know that they said they're going to do a deal for some factory where they'll have test strips in 2024. That's not cutting it.
I have a question for the state in general and you as well, Governor DeSantis.
Okay.
So I heard you just talking about, and even yesterday during the press conference, about how much people are getting tested who are asymptomatic. So I just want to help you, give you guys a chance to clarify this for people, because some people are confused about what was said. So we know COVID-19 is asymptomatic, and it can be transmitted even if you don't have any symptoms. So I think the question for people is, how can you justify having us test less or not test if we have symptoms? How can we justify who's getting tested, who's prioritized, if let's say I'm taking a test just to protect my neighbor, even if I don't have symptoms?
Go ahead.
Yeah. Great, a very clear question. Thank you for that. So, first, we're not saying that people can't go and test themselves. In fact, what we're saying is the very opposite of what the federal government has been saying. So we're saying that it's time to move to a place where people can make voluntary, sensible decisions and be in a sustainable situation and be in a sustainable cycle with COVID and other respiratory viruses out there. So that's what we're saying. We're trying to move back to normal, because what's happened, unfortunately, is that the federal government and the leadership and the federal level in public health has been very successful in normalizing a new vision of health and wellness and living in the United States. And what that looks like is people, unfortunately, having their faces half covered when there's not even good evidence that it's making any benefit, any difference whatsoever. It's been testing people that have no symptoms, are not sick, and calling them cases, people, and making them into people who are sick when they have no symptoms. And it's been just introducing just the most perverse beliefs and sort of norms. So this idea that, you know, to walk into a restaurant, you have to sort of produce your papers or pull out your iPhone and show your vaccination card, or your kid has to do the same thing. You know, there are people in this country that want the country perhaps to look like that and think that's a better way to live. But I think most of the people in this country don't want a country that looks like that. Okay, that's a country that is, you know, you've got freedom on one side and sort of constraints other adjectives that, you know, I'm trying to pick my adjectives carefully here. But freedom's on one side and sort of this other model is on the other side. And it's time to say bye-bye to that other model, and let's go back to people making sort of voluntary decisions, living their lives, pursuing what they want, and not sort of defining everything that they do around whether or not a test is positive or something else like that. So that's what it's about. It's how things used to be, and that's where we're going back to. So, you know, so what that means, again, is that we're not telling people that, you know, you can't get tested. We're not restricting access. But we are saying that we don't think it's sensible that people who are unlikely to benefit, unlikely to have any change in their clinical outcome, to sort of be in line waiting to get tested. That doesn't make a lot of sense to me. It doesn't make a lot of sense to me as a physician. It doesn't make a lot of sense to me as a clinical researcher. It makes no sense. So the guidelines that we're going to be putting out are guidelines that will identify populations for whom testing is more likely to change outcomes, right? If you do a test and it doesn't improve anything, what was the point of the test, right? And we don't always know, which is why we talk about risk factors. So the guidance that we're going to be putting out will be we'll be providing guidance about testing based on risk factors, based on risk level, because that's the primary item that determines whether or not a test is actually likely to make a difference. In fact, for people like young people who, you know, have no risk factors, or people who are on their third test in a week, and we know that happens, you know, everyone knows that that happens. Those situations not only don't improve clinical outcomes, they actually sometimes worsen clinical outcomes. And in fact, unfortunately, the federal leadership made it such that those situations made outcomes much worse. A great example for that are all the healthy kids who tested positive or had an exposure to someone who had COVID-19 and ended up staying away from school for a week, for 10 days, for 2 weeks. And we're seeing that. We don't hear a lot of discussion about it, but there have been now published papers that show that all those shutdowns and all those quarantines hurt kids. And that is a darn shame. I'd use stronger words if I could, but that's unacceptable, and we're stopping it, and we're starting here in Florida.
Doctor, don't you need to have testing, though, to get your monoclonal treatment? So obviously, more testing must be available and a positive result in order to get the treatment?
Okay, so testing to get treatment and more testing so you can get treatment are two different things. Yeah, sure, testing to get treatment, absolutely, particularly if you have risk factors for illness. We're not stopping that. We, you know, as the governor has described, we've worked very hard to make tests available. What doesn't make sense is all this testing before people can work, or before people can go to school, or because someone with no risk factors was exposed and has no symptoms whatsoever. This fantasy that the federal leadership has painted that you can somehow stop this pandemic by just doing more testing, I mean, I'm waiting for more people to realize it's completely failed. It's impossible. It has not worked. Part of the reason it hasn't worked is that a substantial proportion of infections are completely asymptomatic. That's part of the reason. The other part of the reason is that not everyone prioritizes or is as scared or worried about COVID as everyone else. You can't force everyone to get tested. It's time to move on to a model where people are directing their energy to the priorities that they feel are important, not what the federal leadership feels is important.
Well, I would just say though, so the people that benefit from this treatment are the ones that, if they develop symptoms, get a quick test and then go in and get your treatment. That's like the perfect reason why you would want to be tested. And that's one of the reasons why, with the federal government not coming through with these at home, we want to prioritize our elderly population. Nursing homes want them, ALFs, senior communities. We'll also probably provide some of the local emergency management or counties or whatnot if they want to be able to do. But that is a very good example. What is a bad example is when you attach testing requirements to things like getting on an airplane. You think about how that affects the economy and affects people's willingness to travel. There's a lot of people who are going to have second thoughts about, gee, if I go and do a trip and then I end up getting a positive test and I'm totally healthy, but I have a positive test, I have to wait in a foreign destination for 14 days? Forcing healthy people to test to go back to work does not make sense. And so for clinical reasons, that's the whole purpose of it, and that's where we want the testing to go. I mean, as Joe said, you do have people when the kind of the hysteria gets going, you'll have certain people that will go out and will just get tested all the time at some of these sites, and that's not a good use of resources. And so he's going to put out guidance that talks about some of the examples where it makes sense, where it doesn't. But I do think he's 100% right. The idea that if you just had a lot of testing that you could somehow stop the spread or these waves, that has just not happened. I mean, you've seen everywhere the passports, all the stuff that have been tried over the last 6 months. Right now, you look around the country, they are totally crashing and burning. And not only did it not work, it caused a lot of damage. It promoted divisions in our society when you're trying to create effectively second-class citizens based on whether you got a shot or not. We've never done that before in the United States, and I think it's been used in ways that we're going to definitely regret for a lot of times. But it wouldn't be worth doing that even if you could show modest benefit, but you see no benefit. It's been a total failure. So part of the problem with what we see with how this whole thing's gone is, when there are things that fail, there's just a certain segment that just will never admit that and will never move forward on a better foot. And so you're kind of dragged down in some of these parts of the country with some of these legacy policies. But as Joe said, that's one model, a biomedical security state. Not a society I want to live in. And the thing is when you have a free society like Florida, people can choose to be more cautious with what they do, and that's totally within their rights to do it. No one is saying, if you want to govern your affairs based on the whims of someone like a Dr. Fauci, you are free to do that, but you ain't making the rest of us do that, and that's I think the difference between what we're doing here and some other states.
70% of the population wants all antibody treatment for given to 7 states. The 7 states were mostly red states. It was Alabama, Texas, Florida.
Yeah, well, why is that, though? Why is that?
I understand that the Biden administration was trying to even out the ground for the other states, since these red states, 7 red states, including Florida.
Well, but why was that the case? So the question is, last summer there were a handful of states, and he's terming them red states. I don't know why that would matter. Who had the Delta wave was a southern wave. It hit the South in a seasonal pattern, just like 2020 was a seasonal pattern. Now you're seeing a seasonal wave in the Northeast. And as much as people like you would like to say this is based on your political affiliation, that's not how viral curves work. So we were using more of it because we had more prevalence, but I'd say just as significantly, we actually embraced the treatment. I was attacked when we rolled out this monoclonal site by press outlets, by the left. They were attacking me for doing it. They acted like it was like voodoo, that this wasn't something that was, and then what you saw is people were getting the treatment, they'd tell their friends, their neighbors, all of a sudden people were going out, and this was a big thing in Florida because people saw the results of it. So that is why we were using more. Now you're in a situation where you have massive prevalence in places like DC and New York and all those other places. They are getting more, but you know, they haven't embraced it the way that we do. But here's what my question would be: why are we even in a situation where we are concerned about who gets what? We've had these available for over a year. Why aren't there enough? If the federal government has taken control of this, why didn't they ensure that there would be plentiful supply of this to be able to keep people from being hospitalized because of COVID? Why were they asleep at the switch on that? Why not do it? And why, especially after you saw the positive effect it had in dealing with Delta in the southern states, why wouldn't you have done it? And look, they're under no obligation in some respects to, to purchase this on their own. But when they don't let us do it, when they have these exclusive agreements, then that's a huge problem. So let us buy some. We will buy some. We bought as much sotrovimab as we could. That's now off the table. So let's just be real here. The fact that we're even talking about over a year, this stuff came out in December of 2020 under EUA. Sotrovimab came out in the spring of 2021 under EUA. There's plentiful time for them to have gotten this in gear. And I think the fact that they haven't is part of it. They don't believe in the treatment. They said, remember, Fauci said if 50% get vaxxed, there'll be no more waves. Well, we have way more than that across the country, and you have some of the biggest waves you've seen yet. So that was wrong, but they're not willing to pivot to the treatments, and I just think that that's unfortunate. But why you would try to play politics with it? The people that are coming to get treatments, like, you say red state or not, how do you know? I mean, is that person either way? I mean, that's just not the way to think about it.
I apologize for saying red states, but these have been states that have been very resistant to vaccines and masks.
That's not true. First of all, that's not true. Florida over the summer and today has had higher vaccination rate than the U.S. as a whole. That's just the fact. We've had the highest in the Southeast for pretty much the whole time. We have over 90% of our elderly population for many months has had vaccination. The fact of the matter is the vast majority of people who get monoclonal treatments have been vaccinated. I know that doesn't fit the narrative. Go down and look at the Miami-Dade site. They actually put it out every day. How many people got treatments, how many were vaxxed versus not vaxxed, and it's always 2, 3, 4 to 1 vaxxed to unvaxxed. So that's just the reality. And so to use the vaccine as a reason to deny treatment or our policies regarding, and let's be honest, they wanted mandatory vaccinations. That's what they were pushing for. Passports to where you can't go into a restaurant. I mean, a 5-year-old kid can't go someplace because he hasn't done this. The clinical trial for 5 to 11-year-olds for Pfizer found no severe COVID outcomes for either the vaccine arm or the control arm. Nobody got severe COVID in that clinical trial, and it was not a very big clinical trial. And so, okay, not one severe case, so why would you deny a kid the ability to do it? But that's what they wanted to do. They wanted it to be mandatory to even send a kid to school with COVID vaccine. They wanted a whole bunch of other policies, and we resisted that. They wanted people to lose their jobs. If they had their way, you would have police officers fired because of this choice. Firefighters would be terminated because of this choice. Nurses, we've stood up for nurses and saved a lot of jobs. So Florida did that. We were one of the few states that stood up and said, we are not going to deny you the ability to earn a living based off your choice on a shot. And that is much different than, I think, what you've seen from the federal leadership. But here we are looking at it now. Clearly those heavy-handed policies have not worked, because if they did work, they would not be dealing with any significant COVID right now. And so we just have to understand that, and what great cost have they imposed on our social fabric, on our economy, on people's conception of their individual rights. I mean, it has been a disaster. But even putting that aside, the fact that we approached it different from a mandate perspective is not a basis to deny treatment to Floridians who may need it. So Joe's going to keep fighting, I'm going to keep fighting, we're all going to keep fighting. We have the infrastructure in place. If those shipments come, there'll be a site, another site in Jacksonville the next day. If they come, there'll be sites in South Florida, Central Florida, all across. We're ready. The legislature, we got the money. We have money set aside. We're ready. But we can't do it. We can't give people treatments if the federal government's withholding the treatments. So send us the treatments and let's get it done. Okay, we got to run. Come on, buddy.
I have one question.
Come on, buddy.
Question, doctor.
Which way? Oh, okay.